nice to have you back for Module 2. As we have learned, suicide is the second leading cause of death for youth ages 10 through 24 in the United States. But let's focus on what we can do rather than the statistics that don't change behavior. In doing so, we must talk about suicide awareness and good mental health. How can suicide awareness promote good mental health? Increasing awareness and educating others about signs and symptoms you can help prevent future deaths by suicide. My purpose is to inform you about signs and symptoms in hope that you will recognize what an important role you play as a teacher in preventing youth suicide. Being able to inform you, the frontline responders, for your students will help to normalize experiences about mental health so that you are equipped to speak with and work with your students about good mental health so that your students do not feel so alone and therefore feel comfortable turning to others for support. You can focus on building relationships with your students and providing skills so that your students learn how to care for themselves and manage stressors, which will help them not only mentally but physically. Taking care of one's own mental health is empowering. Learning how to manage helps one to feel in control and reinforces that they are capable of doing so. Once their symptoms of distress are managed, your students are better equipped to tap into other strengths and get to know themselves in a new way. You are your student's superhero. It is important that you are equipped with performing these duties, helping to prevent mental illness, providing the opportunity for early intervention, helping your students normalize their thoughts and feelings, and starting a conversation, giving your students permission to talk about such difficult topics, helping your students with the ability to learn and better equipped in coping with stressors that they face, and being able to support the improvement of your students' academic performance by speaking and addressing the values of good mental health. Having the ability to help to improve your students' overall health and well-being, and being able to build on your students' self-esteem so they can realize their full potential. Suicide is preventable, and here is what you can do as a teacher. Talk to your student about good mental health and suicide. Don't be afraid. You will not be putting ideas into their heads. Asking for help is the single most important skill for your students, and you can protect your student from the potential of suicide. Help your students be able to identify and connect with caring, reliable adults that they can talk to when they need guidance and support. Watch for and identify signs and changes with your students. Many suicidal people give some sign of their intention. These symptoms and signs may indicate a person is at risk for suicide. Know the risk factors and warning signs of suicide, such as noticeable changes in eating or sleeping habits, unexplained or unusually severe violent or rebellious behavior, withdraw from family or friends, school activities that they used to previously enjoy and were involved in, sexual promiscuity, truancy, and vandalism, personality changes, agitation, restlessness, distress, or panicky behavior, noticeable changes in eating or sleeping habits, and talking or writing about suicide, even if they're doing so jokingly, giving away prized possessions, doing poor in school, verbal suicide threats such as "you'd be better off without me," a lack of interest in future plans, references to unbearable feelings of hopelessness, and saying goodbye to family and friends. So what else can you do? Offer help and listen. Don't ignore the problem. What you may have observed may be your student's way of crying out for help. Offer support, understanding, and compassion. Talking about feelings and the behavior you have seen that have caused you to feel concern. You don't need to solve the problem or give advice. Sometimes just caring, listening, and being non-judgmental gives all the understanding necessary when supporting your students. Take talk of suicide seriously and use the word suicide, as difficult as that may be. Talking about suicide doesn't cause suicide, but avoiding what's on your student's mind may make the student feel truly alone and uncared for. Tell your students that together you can develop a strategy to make things better. Ask if your student has a plan for suicide. If he or she does, then seek professional and appropriate help from school staff immediately. Help to facilitate your student being connected to professional help. A student at risk of suicide needs that professional support, even when the immediate crisis has passed. The risk of suicidal behavior remains high until new ways of dealing and coping with problems are learned. Don't be afraid to facilitate your school's policies and procedures. Make no promises with your student. Seek immediate support and assistance. You may not be able to handle the situation on your own. And probably most importantly, as difficult as it is, remain calm. Becoming too excited or distressed will communicate to your students that you are not able to talk about suicide. Listen without judging. This will allow for your students to share and discuss their experiences, thoughts, and feelings, and be prepared for expression of intense feelings. Try to understand the reasons for considering suicide without taking a position about whether or not such behavior is justified. Supervise constantly. Do not leave the student alone until a school crisis team member or administrator has been contacted and is able to provide appropriate supervision. And ask if there is a plan. If so, remove means as long as it does not put you in danger, such as scissors on your desk or pens or pencils, and respond immediately. Escort your student to a member of your school's crisis team. If you are unsure of who is on your school's crisis team, find a principal, an assistant principal, a school social worker, a psychologist, a counselor, or school nurse, and join the crisis team in order to debrief with them the matter impacting your student, because you know your students the best. Provide the essential background information that can help with the screening. The students who are at risk for suicide need your support. When a teacher says this behavior is not like this student, this is critical information. It is important for you to remember, as that student's teacher, that you play a critical role in the prevention of your student's suicide.